welcome back. We are going to, for the next 40 minutes or so, pivot from private insurance to the world of public insurance. And I'm very pleased to introduce my colleague, Adrian Palau-Tejeda, who is going to talk to us about some issues around health equity, Medicaid, and some risks on the horizon, a little further off than we feared. But so with that, welcome, Adrian, and thank you. And I think we can really, there we go. Thank you.
Thanks so much, Miriam. I'm incredibly excited to speak to everyone today about Medicaid, the now put off public health emergency unwinding, and really just discuss risks to watch out for in 2023, as well as public health, public insurance. Thank you. Next slide, please. Like the wonderful introduction Miriam gave me, my name is Adrian Palau-Tejeda. I am the Senior Manager for Health Disparities and Engagement at HFA, and I am pleased today to talk to you about Medicaid and the PHE. Next slide, please. So we're going over, touching on the previous presentation. I'd love to really begin this discussion by discussing the real origins of Medicaid expansion and the changes that we saw and forces for health equity that were created through the Affordable Care Act, which created new opportunities and subsidies to help individuals get better access to health care through subsidies, the marketplace, and Medicaid expansion, allowing states to grant the ability to enroll individuals in Medicaid who had incomes up to 138% of the federal poverty level. Following the passage of the ACA, uninsured rates among Black Americans fell 20% to 12% in an 8-year span, a decline of 40%, due to the amazing efforts included in the Affordable Care Act. Now, since then, the U.S. government has taken many steps to increase enrollment in the marketplace, specifically in response to the COVID-19 pandemic and the public health emergency, increasing outreach and advocacy and efforts to enroll underserved communities and individuals into the public marketplace. During the previous year, this included a record-breaking 14.5 million individuals signing up for healthcare coverage through the marketplace, according to CMS. Specifically, enrollment increased among underserved communities heading into 2022 due to outreach efforts by HHS. Black consumers saw a 49% increase in enrollment from 2020. Latino consumers saw a 53% increase in enrollment from 2020, and American Indian and Alaska Native consumers saw a 32% increase. This isn't just down to any one, increases in ACA enrollment were due to efforts by HHS, but decreases in uninsured rates among underserved communities wasn't down to any one singular action, whether that was marketplace enrollment or Medicaid expansion, but due to the combined efforts to reduce uninsured rates through proactive action by HHS and the Center for Medicaid. Next slide, please. An introduction into Medicaid. Medicaid is a state-administered public health program funded by both the federal government and the states that provides coverage for vulnerable and poor communities. Children's Health Insurance Programs, or CHIP, provides health coverage for uninsured lower-income children who are eligible or ineligible for Medicaid. And some states may also have additional programs like California's Genetically Handicapped Persons Program to help with healthcare costs associated with specific genetic conditions like von Willebrand's disease and hemophilia. Next slide, please. Medicaid has served as an important driver for health equity and expanding coverage for communities of color. For example, according to a study by the Kaiser Family Foundation, nearly 60% of Medicaid enrollees prior to the pandemic were people of color. Medicaid has historically played an important role during economic downturns by enabling families to maintain care, something that we saw immensely during the COVID-19 pandemic, where as a result of the public health emergency, we saw states expand Medicaid access and retain individuals already enrolled. Nationwide Medicaid and CHIP enrollment has increased by nearly 19 million since the start of the pandemic, or over 26%. Some states even experienced growth over 70%, due specifically to the changes brought upon by the public health enrollment. According to the U.S. Census, between 2019 and 2021, the percentage of people with public coverage increased by 1.4%, leading all the way up to 36.8%. So enrollment in public health insurance has greatly increased since going all the way back to the ACA's passage in the early 2010s. Recent studies have found positive effects of the ACA Medicaid expansion across a range of categories, whether that's economic impact on states, health disparities, sexual and reproductive health, mortality, or behavioral health or social determinants of health. Medicaid expansion has had great effects for underserved communities by addressing continued care and access to affordable healthcare. Next, please. Gaps in Medicaid expansion contribute to health disparities. It's no secret that among the states that have not yet undergone Medicaid expansion, that there are also states that have some of the highest populations in the United States and the highest rates of underserved and diverse communities. 11 of the 13 states with the highest uninsured rates nationwide have not expanded Medicaid, and non-expansion states like Texas, Florida, Georgia, and others rank among the most diverse states in the United States. States like Texas are home to the nation's largest population of Black Americans at 3.9 million. Florida and Georgia, respectively, also have the second and third largest populations of Black Americans. South Dakota, as Miriam just said in the chat, has also approved Medicaid expansion by ballot initiative in the last week's election, which is why it's no longer included on the slide here. But a recent report by the Urban Institute found that 3.7 million people would gain health coverage in 2023 if the remaining 12 states were to expand Medicaid eligibility. So we've got a large room to grow, especially due to the fact that the states that remain without Medicaid expansion are states that have, in large part, a great share of the nation's diverse communities, specifically Latino and Black Americans. Research found that between 2014 and 2018, uninsured rates between white and Black adults shrunk by 51% in expansion states versus 33% in non-expansion states. Specifically, uninsured rates among white and Hispanic adults shrank by 45% in expansion states. So the data is there that in expansion states, uninsured rates go down for non-white communities, and the facts are staring us in the face that in non-expansion states, a great deal of the United States' non-white communities live. So in order to really address access to healthcare for underserved communities, Medicaid expansion must be brought to states like Texas, Alabama, Georgia, Florida, and others in order to ensure that the states where the most people live and where underserved communities reside have access to quality healthcare. Next slide, please. So going into the public health emergency unwinding, I do have to make notes that as of November 11th, the public health emergency will remain until spring of 2023, and that we have answered the question of whether the unwinding will begin. We have not answered the question of when exactly it will begin, as we had, as we had looked out for last week. Next slide, please. So changes brought by the public health. So in response to the COVID-19 pandemic, HHS enacted a number of changes designed to combat the pandemic and ensure that families maintained access to quality care, and the healthcare providers had the tools in place to address the growing number of patients and from a population dealing with a pandemic. This included tools to empower state and federal programs, healthcare providers, and insurers, whether that was telehealth or changes to Medicaid to ensure that individuals were not disenrolled. To do this, Congress passed the Families First Coronavirus Response Act, which empowered state Medicaid programs with enhanced federal funding in exchange for a prohibition from dropping individuals from the program or limiting eligibility. And all states agreed to this. So states would not drop individuals from the program, from Medicaid, in exchange for increased funding. So as of September 2020, nearly 19 million more adults and children enrolled in Medicaid and CHIP, an increase of more than 26% over February 2020, bringing the total number of people enrolled in Medicaid to a record 87.9 million, according to the Commonwealth Fund and the American Medical Association. Next slide. Thank you. So, as we know of, November 11th, the public health emergency will be extended into spring of 2023. Though we still remain, cognizant of the fact that this just means that we have to be aware heading into 2023 of what disenrollment could still have, what the impact of disenrollment could still have on underserved communities, individuals enrolled in Medicaid. So going over it's still important to go over what the public health emergency unwinding will look like and the effect that it will have on underserved communities. Due to the fact that the expansion is not a permanent declaration of the public health emergency, but just a expansion into the spring. So with the public health emergency, when it's not extended again, they'll have state Medicaid programs will have 14 months to complete redeterminations for eligibility. And CMS has urged states to pace their eligibility redetermination so as to limit errors. Unfortunately, some states are determined to move on an expedited basis. Additionally, according to a report by Unidos, 4.6 million Latinos and 5.5 million children are likely to be among those who stand to lose coverage as a result of eligibility redeterminations. Specifically, children are among the most vulnerable when it comes to Medicaid eligibility redeterminations, followed by Latinos and Black Americans. Due to the large increase in enrollment due to the COVID-19 pandemic, it's estimated that more than 15 million individuals will be at risk of being disenrolled. Next slide, please. So according to a report from the Assistant Secretary for Planning and Evaluations, potentially 45% of the 15 million individuals who stand to lose coverage, or 6.8 million individuals, will remain eligible but be terminated due to administrative reasons or administrative churning. While Medicaid CMS will do its best to make sure this does not happen by offering, support to state Medicaid programs. It's an unfortunate prediction based off of statistical analysis of the past. So unfortunately, as many as 16 million individuals are expected to lose Medicaid coverage as a result of the public health emergency unwinding. Following disenrollment, consumers will have a 60-day special enrollment period in which they can transition to a new coverage under the ACA marketplace. So making sure that this isn't all just doom. We do want to make sure that individuals have the tools in place to know what to do if they are in fact disenrolled from Medicaid following the eventual public health emergency unwinding. So if you are disenrolled due to eligibility redeterminations, you will have a 60-day special enrollment period in which you can transition to new coverage underneath the ACA. And due to expansions due to the Inflation Reduction Act, individuals will be able to enroll in even better health insurance if they meet the criteria for subsidies. And this is especially important since unfortunately studies have found in the past that only 5% of individuals terminated from Medicaid successfully re-enroll in marketplace plans. While HHS has made plans to expand enrollment in the marketplace, which leads us back to that 14.5 million individuals who have enrolled in the previous year, and the sheer efforts that HHS has made to increase enrollment in the marketplace by underserved communities who make up the majority of Medicaid. It's incredibly cognizant for consumers and individuals on Medicaid to be cognizant of the fact that cognizant of the public health emergencies timetable, so that they don't fall into that 95% of individuals. Next slide, please. So actions for individuals on Medicaid. So HHS has now announced that it will, in fact, renewing the public health emergency, but it will, when the time comes that it will not announce it, it will give at least, when it comes to the moment when HHS will announce that the public health emergency will in fact be unwinding, they'll have to give a 60-day warning before not renewing the public health emergency and triggering the Medicaid unwinding. As it stated before, states will have a 14-month period to complete enrollment re-eligibility determinations, but it's important for you to stay up to date even before the actual unwinding itself or before the 14-month period, so as to make sure that you don't fall out of that 60-day special enrollment period granted from the eligibility redeterminations. And you can do this by staying up to date by subscribing to Word from Washington from HFA, as well as being on the lookout yourself for any news. Make sure your contact information with your state Medicaid agency is up to date. Open up all correspondence and respond promptly to avoid accidental termination. And if you've been disenrolled in your state Medicaid program, again, you will have 60-day special enrollment period into the ACA regardless of the year. And be sure to complete enrollment within this time period to ensure that you do not lack coverage. Please reach out to your state HTC and state and social workers for information to help. HFA and other national patient groups continue to advocate with Medicaid about need for guardrails and oversight of the redetermination process. We encourage member organizations to outreach and amplify the message vigilance. Next slide, please. Additionally, we're finding resources. We really encourage, looking at some of the resources linked in the chat, and reaching out to HFA for support. If you encounter barriers to accessing healthcare, please reach out to the HFA team for resources and support. This includes Helping Hands, reaching out directly to the policy and advocacy team, and taking calls from the community on any insurance. We're still taking calls from the community on any insurance issues that they may encounter or need assistance. And whether you're facing hurdles in gaining coverage or require assistance advocating to your provider. We also have our open enrollment guides, as well as our resources on Medicaid. And your clinics remain an important and powerful force in understanding and helping you address insurance concerns. And there's only one thing I really want to make clear, from this presentation, it's that the impact that Medicaid has had on underserved communities over the past, decade, and Medicaid expansion specifically, has been incredibly important. Even before the public health emergency unwinding, we saw Medicaid serving as a very powerful force in ensuring that poor communities and specifically underserved poor communities from marginalized groups such as Latino Americans, Asian Americans, and Black Americans having access to public healthcare. And with the ACA, we've really seen an increase in, insurance for these communities. And even though there's still room to grow, specifically in those very populous states, states like Georgia, North Carolina, Texas, and Florida rank among the most populous states in the entire nation, with Florida and Texas being number 2 and 3. It's incredibly important that we continue to advocate for Medicaid expansion to ensure that those communities within those states have access to the same resources that individuals have had in Medicaid states. Looking at in terms of resources, if you're in states, there's still access to the national marketplace. Next slide, please. Additionally, please consider looking out to local chapters and other organizations for support. Consider reaching out to your local chapter. We've included here, we have, guides from the National Hemophilia Foundation, as well as examples from local chapters who have resources specifically on insurance, whether that's the Arizona Bleeding Disorder Foundation, Hemophilia chapter of Southern California. We really recommend reaching out to your HTC as well as your local member organizations if you encounter any issues with Medicaid, or if you're just planning ahead in case you are disenrolled. Again, going back to the sheer rates, one of the biggest issues when it comes to ensuring that individuals are still on ensuring that individuals transfer over from Medicaid in case they're disenrolled is just that they are keeping on top of everything and meeting the deadlines. Whether individuals are redetermined due to administrative churning, it's just so important that you stay within that 60-day enrollment period, and understand that it is a short period of time. Thank you.
Thanks, Adrian. You had one question, and again, please feel free to enter questions into the chat about just seeking some more clarity about is there an exact date for the end of the public health emergency? And I think you've said no, and we're dealing with 2 overlapping sets of time measurements. Is that right? Like we've got the 90-day period and then the 60-day. So the 60-day period is a promise that the Biden administration made to the states, right? Knowing that the unwinding is going to cause them a lot of work, that all of a sudden a process that they haven't been doing for 3 years now is going to start again. So the Biden administration said states will give you a 60 days heads up. But the 90-day up till now, the public health emergency declarations, each one has run for 90 days. Yeah. Is that right? So the current one ends in January 11th, but we're now past the 60 days. Yes. So we think it will be extended, but it might not for the full 90 days. Is that right? We don't know that piece yet.
Yeah, there's a lot of uncertainty currently in place, but I really wanted to highlight with the 60-day that it is a promise from the Biden administration that we will know 60 days before the official non-renewal declaration. Currently, it looks like we're going to be heading into spring due to a desire from the Biden administration to tackle any winter COVID cases, or make sure that we're. I think it sometimes gets the Biden administration with the public health emergency, with all of the amazing things that it's done just in healthcare and in access. The public health emergency does exist and is guaranteed, is the reason behind the public health emergency is in combating the pandemic, and it is in addressing, healthcare concerns from the pandemic specifically and only. So, looking at the winter reports that I've read said that, in order to deal with winter COVID cases, that's the argument behind extending the public health emergency into the spring. But with the 60-day notice, there'll be, It's just a promise that they'll be saying before the actual end of the current period that 6 days beforehand, we will not be renewing it.
Got it. And that timing makes me realize that will be a full 3 years. If the public health emergency unwinding doesn't happen before spring, that means there are 3 years during which state Medicaids have not, some have done eligibility redeterminations, but they couldn't act on them. So, and many state Medicaid agencies have themselves been understaffed during this period, right? So they are facing a real bottleneck of work with 3 years worth of redeterminations. I think that's why the concern is so high about administrative error.
Yeah.
That just processing that volume of renewals could let people slip through the cracks.
And the numbers quoted for administrative churning are based off of, you know, statistical and historical analysis. It's not based off of any, you know, the prediction is based off of administrative churning in the past and administrative issues in the past. You know, it is rate at which, you know, the actual rate that, you know, individuals might be, you know, disenrolled due to administrative error, which, like you said, the rate that it's increased has been so great. I mean, that's 20 million more individuals who are now on Medicare, and having to, you know, do eligibility determinations for, you know, everyone. The actual rate of administrative errors could be greater, could be less, but it definitely could be actually greater than what is estimated, which puts the same estimates for, you know, underserved communities like the Hispanic community or for children. It gives cause for concern.
Sure. And the amount of economic dislocation that started early in the pandemic, I would imagine might have been cause for people to move. And 3 years is a lot of time. Lots of people move over a 3-year time, so that updating of your contact information becomes really important, right? You may not have been getting regular communications from your Medicaid agency, and you may have moved in that time.
Yeah, no, definitely. And sorry, just thought just right out of my head. No, but it really does create a really big issue because, like you said, 3 years is an incredible amount of time, and expecting individuals to stay pat for 3 years or to maintain the same, you know, communication, or just, you know, that the study that found that 5% of individuals that are terminated do not re-enroll into market plans is incredibly scary. And especially with 3 years of time, you know, passing since the declaration of the public health emergency, emails get, you know, email passwords get lost, emails get shut down, you know, individuals' contact information changes. You know, personal anecdote, I realized when I was doing my taxes that the address that I had listed, you know, currently was from a city that I lived in, you know, 4 years ago. And those anecdotes and those experiences and the simple act of moving or losing a you know, email password can seem small, but they can have big impacts on, you know, getting the correct information or making sure that you're enrolling in that during that 60-day special enrollment period you have after, you know, being disenrolled. And 60 days is short. 60 days is 2 months. It can pass by like that.
Yeah. There's also a particular difficulty, I think, for, you know, you highlighted the Medicaid non-expansion states. So we know we have community members living in those 11 remaining non-expansion states. And some people, you know, maybe it's the child with a bleeding disorder, they may have aged out of Medicaid eligibility under the rules of their state, but they haven't been kicked off because of the public health emergency. So, some people who lose Medicaid coverage, if they are not in a coverage gap, if their income is high enough, if they got a better job, they will be able to go to the marketplace. CMS is trying to ease the on-ramp, the connection from Medicaid to the marketplace for those people. But it's a particular risk for those members of our community who may have aged out of Medicaid eligibility, but they live in a non-expansion state.
Mm-hmm.
And for those, I think your suggestion of going to your HTC social worker and always, feel free to come to HFA. There may be a hemophilia specific program that can help pay your premiums, even if you don't qualify for subsidies in the marketplace. But that's a pretty tough find. And just, I guess, underscores your point of the importance of continuing to advocate for Medicaid expansion in all 50 states, which we do.
Yeah, and one point to the previous point of the actual timing, the time periods and all this is so in flux. That's really the largest issue, is that we don't know how long the PHE is being expanded. We don't know how long states will individually take to complete the eligibility redeterminations. They're given a 14-month period, but some states could do it quicker and some states could do it faster. You could be disenrolled months later, or you could be disenrolled pretty abruptly. So that's why, being cognizant and being aware, making sure your information's up to date, making sure that you're, seeking help from, your HCC, your social worker, you're seeking help from, member organizations is so incredibly important, because there's so much influx in terms of timetables, and there's no clear, real, set unwinding plan that is on a strict timetable being given out.
Yeah, no, that's an excellent plan. And your point that different states are going to approach this differently. CMS is kind of putting out some foundational expectations of states that, like using different methods of outreach, whether it's text as well as email, as well as snail mail, and standards for how many times they have to try to contact you before they can disenroll you. But there is going to be variation among the states. And so I think you're right. Our bottom line is open your mail, pay, please keep an eye on this. And please know that HFA will be putting out messaging on this. And if you are at a member org, we would love it if you would help amplify that messaging. Someone did ask, how do I know if Medicaid was expanded in my state?
Well, if you're not one of the states that we listed, and if you're not in a non-expansion state, then Medicaid has been expanded in your state. And going over it off the top of my head, that would be non-expansion states, include Tennessee. Thank you. 11 states remain without Medicaid expansion. That's Alabama, Florida, Georgia, Kansas, Mississippi, North Carolina, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. And again, going over the fact that not only are these states among the most diverse states in the entire country, they are also among the most populous. States like Florida, Alabama, Georgia, and Texas, and North Carolina make up a good chunk of the United States' population just by themselves. So just based off the states without Medicaid expansion, there is a good chance that it's worth noting if you're in a non-expansion state, especially given how many underserved communities are present there.
And KFF, which is a great resource online, has a tracker, and I put a link to their map. You can see South Dakota appears in blue because they just approved Medicaid expansion, but they haven't implemented it, obviously, since it was the vote was just last week.
And similar with South Dakota.
Sorry, did I say yes, South Dakota? I hope I did not say South Carolina because they have not expanded. Well, thank you, Adrian. That was a great presentation, and we will stay tuned, and HFA is committed to Medicaid expansion, to health equity, and we will do what we can to publicize actions that people can take as the unwinding approaches, and through coalitions to keep advocating for safeguards, for guardrails around that unwinding, which we have done. We're in coalitions that have written to all 50 state Medicaid agencies. We have engaged with CMS, and we will continue fighting for guardrails around that process. So thank you.
Thank you so much, Miriam.